You've probably heard in the news about the increase in heart disease and how now people have a higher blood pressure than ever before. But what does this actually mean? Why is this happening? And what can we do to treat it? Well, you're going to learn just that in this video. Let's start with the coronary heart disease, or CHD in short. It's when fatty deposits build up in your coronary arteries, aka very important arteries, making them narrower and therefore reducing blood flow to the heart muscle. This is bad news. Less blood flow means less oxygen to the heart's muscles, so less aerobic respiration. This means that the poor heart has to work extra hard to get energy. What makes this bad situation even worse is high blood pressure. High blood pressure puts extra pressure on the arteries' walls, making them even more susceptible to narrowing. This happens because if your blood pressure is too high, the muscles in the artery need to respond by pushing back harder, and so they become more muscular, and so there is less space for the blood to flow through. Combined with a coronary heart disease, this can lead to heart attacks, or worse, death. But why does this happen? Well, there are a number of factors, including age, smoking, diet, and physical activity. The older you are and the more you smoke, the higher the chances. Diet and physical activity also have a big effect on blood pressure, as well as cholesterol and weight, all of which are risk factors of coronary heart disease. So how are these problems fixed? To keep blocked arteries open, stents can be used. They're inserted by something called a catheter, a thin, flexible, long tube. It's fed through an artery until it reaches the blocked section. A small balloon inside the stent is inflated, pushing the plaque and fatty deposits against the artery wall. The stent is a metal cage, which then holds the artery open. This allows more blood to flow through. The catheter is then removed, leaving the stent in place. Although stents are very useful, they do come with some risks. Statins are a pill used to lower cholesterol. They work in two ways. Firstly, by slowing down the production of cholesterol by the liver, reducing the amount of bad LDL cholesterol circulating the blood. They also stabilize and slow down the rate of fatty deposits in the arteries. In fact, they're the most commonly prescribed drug in the UK and second most in the US. Statins reduce the risk of developing CHD and minimizes its effect, but again, there are possible side effects. These serious side effects are very rare, less than 1 in 10,000. So we've seen stents and statins. We can also replace faulty valves. The job of heart valves is to prevent the black flow of blood. Sometimes one or more of these valves stop doing its job properly, and when this happens, many people need little or no treatment, but sometimes surgery is needed. Surgery can either repair a valve or be a full valve replacement. Replacement valves can be man-made or from a donor. Did you know that donor valves can come from either a human or an animal? These biological replacement valves may be preferred as they don't damage red blood cells, but are also known to harden and need replacing every 10 to 20 years. Mechanical are a lot more durable, but patients have to constantly take anti-blood clotting drugs, and some even say they can hear their own valves. If someone's heart is seriously damaged, they'll need a new one. This is known as a transplant. This is done by removing their heart and connecting the new one to the aorta and the pulmonary artery. Can you spot the potential problem in this process? Pause the video and have a think. While surgery is going on, the patient won't have a heart. This is solved by connecting the patient to a heart-lung bypass machine, which takes over the job of the heart and lungs. Because it's major surgery, there are some risks. So there we have heart disease, the treatments and their risks.
If you liked the video, give it a thumbs up and don't forget to subscribe.